Ever wonder why an otherwise healthy man or woman would suddenly have a devastating stroke or heart attack? They ate right, exercised, didn't smoke or drink to excess, but still, there you are, going to their funeral. There has to be something missing from the cholesterol, flabby, fat, heart paradigm that blames the victim for the disease. And there is. There's a cause. Bad bugs. The kind that make your breath smell bad in the morning. The kind that may make your dental floss pink or your toothbrush pink when you brush. The kind that infects more than 90% of the human population and are treated effectively only by a very few dentists.
And pour me a little bit.
Bad bugs that look like snakes and eat away at your gums and get into your bloodstream and wreak havoc with your arteries, immune system, not to mention the bone around your teeth. That's a missing link, and it can be corrected. Viruses are so small you can't see them. They're below the resolution that a light microscope will show you. So you have to use other means of figuring out what's in there and what's accelerating the disease. It's not the only cause. It's just one of them. The weight of the evidence indicates the strong likelihood of Entamoeba gingivalis being the primary periodontal pathogen with systemic manifestations in the destructive periodontal disease. And that's Trevor Lyon. He gave a class for the IMT. And he started with an amoeba on the screen and a beautiful microscope like that, and he just followed it. And so his class was 1 hour long, and so that screen followed that amoeba for 1 hour as it slunk around on the screen and went over here, and the spirochetes just stood back. So here comes the amoeba. Don't bother the amoeba. And so the amoeba must have had a hall pass or something. they didn't bother it at all. And it slinks around, and periodically snatch up a white blood cell and eat it. You know, this is the tank, and they're the soldiers. It would just run up to a white blood cell and eat it, and then you could see the white nucleus go inside the amoeba. It would go on and find another one, eat it, and at the end of this long video, as Trevor's going through the life cycle of amoebas and how they get embedded in livers and gums and tissues in the intestine, and they're not limited. They can actually go through tissues, break cell walls, eat their way into whatever they want to. And he said that they are supposedly asexual, but there's one of the nice things about microscopes is you can see what's going on. And he said what he'd observed is that at certain times all the amoebas gather together and they run over each other, and they just kind of all get around like this, and they all kind of run around, so it's kind of like a hoedown, and they just have a whole good time. And then what they do is they break into multiple pieces, and they have little pieces of themselves all over, and so we have more amoebas. Well, is that asexual or is it just party sexual? I don't know. But anyway, he's wrong on the amoeba being causal. And how come I say that? Because it's not there when the disease began. If it's causal, it has to be there at the beginning of the disease. And so what it is, it's a late-term invader when the environment is good for it. And I'm thinking of the trouble that they're having with the great white sharks that are now hanging off the coast because they could kill the seals, and now the seals are there, and so now the sharks are there. So what's the amoeba? Needs white blood cells. Well, so it's going to show up where there's plenty of white blood cells. So why are the white blood cells there? They're there because you've got periodontal infection, you've got the spirochetes there. And so it's actually a whole ecology. And so if you get rid of the infection, And I thought I could get rid of the amoeba topically, because you can kill an amoeba, you put iodine on it and not. And so for years I thought I was getting rid of amoebas topically. And then I got Trevor's lecture, and he said, how are you preserving your sample? And I said, well, I use the half-ringer solution that Bill Landers sells with the microscope. And you get one bottle and it lasts you about 10 years. Because you don't want a lot, you don't want swimming, you want a little thin layer. And he said, well, they don't like that. So when you put them in that, they turn into a little tiny ball, and they shrink up. They look exactly like white blood cells, except their cytoplasm doesn't bubble. And he said, I suggest that you use saliva, because that's what they're used to swimming in, and they like it. It's got nutrients in it. Get moving. And he said they're also heat sensitive. So when you take it out of the warm mouth and put them on a cold slide, that makes them go to the vein. And so he said, let them sit and warm up on the stage of the microscope. The light shining through will warm them up, and then they'll try to get out of the light. And so they'll have a reason to go someplace. And there was a very famous physician that treated arthritis. And that what he did is he put an ice cube on one end of his slide and heat on the other. And he took samples out of joints that were arthritic. And he could always catch amoebas heading over toward the heat. So it's like people who go to California. They had sunglasses, I don't know. But anyway, Khalil Gibran says that in the Prophet, there are no eyes so blind that those that will not see. And so until my ear told me that I should see this, I hadn't seen it. And I'd been looking at a microscope for a decade at that time. I hadn't seen it. And then the very next person that walks in the office, whoa, look at it go. So we'll get to that. I'll play that. Chloramine T is a chlorine molecule with an ammonia group off of it. It's used in most water treatment plants. Really cheap. You should be able to buy about 100 tons of it for $5. Enough to last you for 2 careers. And I quit using it. Monica and I made a documentary not too long ago. And one of the people she interviewed was a toxicologist for Bill Marcus. He was actually the toxicologist at the Office of Drinking Water at the EPA. And Bill was telling her what a great job it is to be a toxicologist in the EPA. He said the question came up is chlorine in the water supply associated with prostate and breast cancer? And he said, so, with my unlimited funds, I hired 10, not 1, not 2, but 10 different firms to go out and check the possibility out of whether or not chlorine in the water supply was associated with adverse outcome with breast cancer and prostate cancer. And he said when his report came back, he said every single study showed a positive relationship between chlorine and breast cancer and chlorine and prostate cancer. More chlorine, more cancer. More chlorine, more cancer. More chlorine, more cancer. And so he did a meta-analysis where you take all these studies, he designed them so that they were all combinable, and you combine them all, and the p-value, which is the chances of this being a random act of God, was like same as a snowball in hell. It was like three or four zeros. So he said, obviously chlorine is harmful, especially when it's in the water supply. So the EPA solution was to put chloramine T in the water supply, which they haven't studied yet. Oh, that's not, yeah. We'll put something else in because we haven't studied yet. And please, zinc chloride. Where would you find that? Scope. It's the killer in scope, and there are cavitrons that have you can blow medicine through your cavitron. And there used to be a thing called a plug buster, and basically they would take the window squirter bottle out of a Volkswagen. It's a real hard, durable plastic bottle, and you put compressed air in one side, and you put whatever you wanted to in that bottle, and that was the water supply for your cavitron. Ruins your cavitron, but not right away. And if you're on fresh water, it'll last longer. But hey, now our ultrasonic becomes a bug buster. But I'll talk to you about bugs, you need to kill them before you do anything. My grandmother died of childbed fever. She had 6 children, died with my aunt. Semmelweis was a young man and went to the finest medical school in the world, was in Vienna. And so in medicine back in the 1800s, there were 2 fields of medicine. Baby delivery and dead people. And so he got into the baby delivery part. And he actually had a women's hospital. It was a clinic, for a birthing clinic. And he had on his staff midwives, laundresses, and woodcutters. And, well, what do you need woodcutters for? Well, they go out to the woods, they chop down a bunch of trees, and they had a giant kettle of water boiling all the time. And so they did boiled laundry, and if the woman arrived for her delivery before she was breeching, before the baby had crowned, they would give her a bath. Well, you know, in Vienna, how many people took baths in the winter? About the same number as the people in Maine in 18. So this was the first bath that she had, but they scrubbed her down and they used a real potent soap and scrubbed her down real good before she gave birth, moved her to a bed that had sheets on it that had been boiled, and then he insisted on the sheets being hot ironed. You had to iron them with a blistering hot iron they had multiple irons on the fire, and they would just iron all these sheets with blistering hot. And that was the sheets that she got on. And all the midwives washed their hands in a lye solution, which was their soap at the time. And really good for your skin too, I'm sure. And then and he had a success rate of delivering live babies about the same as America today. And they drove him out of town. He died of broken nose. And my grandmother, 100 years later, died from the problem that he'd solved. So my consternation is, why does it take 100 years for something as stupid as washing your hands before you deliver a baby to get involved in medicine? And it's dogma. I hate dogma. Because the guy that drove him out of town, as he wiped his bloody hands on his leather apron after doing an autopsy and delivered a baby who died of the same thing that the autopsy person did. Nothing could be on the hands of a learned doctor that any way would harm a mother and her dear child. Damn dog. So, what else can you kill them with? Any kind of salt. Some people say, oh, I'm sensitive to sodium. Okay. I have a degree in biochemistry. So, salt is metal hooked to an inorganic molecule. So, potassium chloride, sodium chloride, Epsom salts, magnesium sulfate, potassium acetate, those are salts. Any kind of metal hooked to an inorganic molecule is a salt. Well, why does salt kill bacteria? The salt sucks them out, sucks all the water out of them, and they die.
Here's my simple recipe for oral health. First, you take 1 large mason jar. Glass is best, but plastic will do. Then add 1 inch of salt and 1 inch of baking soda. Now pour in enough hot water to fill up the jar and then mix it. Now set it under the sink and let all that unused salt and soda sink to the bottom before you use it. Grit in your irrigating solution will plug your water irrigator, so let the grit settle out. Next, you can begin your normal oral hygiene procedures such as flossing, toothbrushing with the bass brush, toothpicking, to stir up the gooey bacteria that grows on the teeth and clogs up the gums. Once the grit has settled to the bottom, you've made what's called a saturated salt solution, but it's really too strong. So now you can dilute it 50-50 with warm water, and the temperature will be just perfect. You can add a splash of iodine if you like, but now you're ready to irrigate. Check the power setting to make sure it's on low, and you're going to use the big tip, which you can point in between your teeth one at a time all around your mouth, first outside and then inside. The reason you're using the low setting is that you're not doing a car wash. You do not need to blast these bacteria off your teeth And just as we showed you in the earlier part, you can blast them into your bloodstream too. You don't want to do that. You just want to rinse them away gently with a good firm stream of water. Once you've finished with the irrigator, you need to rinse out the irrigator or it won't run next time. Salt will plug it up. So all you got to do is run some fresh water through the irrigator before you put it away.
You got to change the way you think about it. You're dealing with an organism, or multiple kinds of organisms, that can be moved by when you brush around. So you can't do quadrant scaling. You can't clean a quarter of the mouth any more than you can wipe half your rear. That won't work. Come back next week, we'll do the other half. So we do the whole mouth every time we see the patient. We can scrape one area, or if we want to. What Trevor did is Trevor would not touch the gums for 6 weeks because he would disinfect the gums for 6 weeks. And he spent that whole 6 weeks having the patient come in, flushing them out. If he was after amoebas, he used metronidazole. He'd pack that in the gums, have to take it orally. Over and over again, he would disinfect, disinfect, disinfect. And at the end of 6 weeks, he had pictures. It's just amazing. Here's this ring of tartar sitting up about a quarter inch above the gum. Oh, wow, I can knock that off with a shovel. It makes your life so much easier because now instead of slopping around through bleedy, pussy gums and all that stuff, the gums are well. And the only reason you've got a scaler at all is because you've got that barnacle in there. And that barnacle is actually a bacterial contaminating. So you can get into real estate that way. Gum realtors. I like to call us gum gardeners, but the gum realtors. Well, actually, gum realtors are destroyers because we're ruining their condos. Colloidal silver, pretty good, but you know, there is a thing that some people drink colloidal silver, which I think is like moderately insane, because they turn silver colors. Look it up at Wikipedia, it's an arginosis, so, so use it topically, but don't swallow it, it's good. Before you do anything, figure what you're after. And here's my mentor, Dr. C.C. Bass. And he's sitting there with a tooth model, and on the other side of his desk is a microscope. That's how he figured out. He invented the brush first, but he didn't get rid of all the organisms. And so he went into his wife's sewing basket, and he got out her button thread, which is basically the POH floss, it's nylon thread. And he worked with that and looked on the microscope, and it got better, but it still wasn't there. And that's when he went and got the hose and stuck it on the faucet and irrigated. The bad guys are swimmers. If you think you can get a swimmer by snapping at it with a piece of string, go ahead. It'll make it look better, yes. I'm not saying it doesn't make it look better, but if you're using your eye to see if you're done, then you're just as stupid as I was. I'm a little cheap. And some of these microscopes can cost almost as much as the tire for my airplane. So I was reluctant to buy a microscope. And my good friend Jim Knott had been using a microscope for probably a decade by the time he came into my office. Put that microscope, plugged the light in, and he said, "Kennedy, you need to look at bugs." And I said, "Where'd you get that microscope?" He said, "That's a 1930 Zeiss microscope that his father had taken with him when he became a mine physician in Ethiopia. They were mining in Ethiopia, and the workers were so sick, they hired Jim Knott's father to come and help make them well. He's got a notebook in his office of people that were carrying hernias around in wheelbarrows. I'm serious. Hernias in wheelbarrows, and elephantiasis, and legs that were blown out. And so when he put the microscope there, I started looking at some of my successful cases, and I was shocked that the usual suspects were there. I was not successful. I was using my eyeball. You know, as Bill Landers talks in the sharp metal ruler. And I thought that I had done a good job, and I wasn't correct. And so that was a humbling experience to me, because I've been doing this so long manually with my eyeball and my sharp metal ruler that I thought I knew what I was doing. And then along comes somebody that says, look at him! Look at him crawl away! Now kill him! And it makes all the difference in the world. Your cases will be so much better. And that's the bass brush. And if you got a job, say the hygiene business kind of fell in hard times, everybody started taking care of their own mouth, put an irrigator, and got well. So you had to find something else to do. And so you saw in the paper that they wanted somebody to lie on a bed of nails at the circus. And so you said, I think I'll apply for that. It's got to be a pretty easy job. You just lie down, right? And so you go there and they show you the bed and it's only got one nail. Well, that's the trouble with an Oral B60 or 40 or Colgate or any of the bristles. They got too many bristles. You could do the boogaloo on that. It would not hurt you because too many bristles. And that's what C.C. Bass figured out. If you take most of the bristles away, now they penetrate. Now they go down deep into the sulcus. They brush in between the teeth. And he was such a great guy and gave it to the profession. I'm going to give it to you. So I brought you a bass brush. Woo-hoo! Who wants a bass brush? I would like to show you what I call the usual suspects off of the old Humphrey Bogart movie. Because you don't have to do this too often to realize that there are, as Debbie pointed out yesterday, there's a list of bugs that are bad. And there's a list of bugs that are good. And she didn't tell you the difference between the two lists. The good ones sit still. The bad ones run away. So if we can see something running away on the slide, it's a bad guy. I guarantee it. Even urinary tract infections. I was a medical technologist. You take a sample, look under there, if something's running away, oh, got a urinary tract, UTI. Because vegetative bacteria are much less harmful to us than the ones that swim around. And that's actually how the bug gets up the urethra, is it's a swimmer. So it gets up the urethra and causes a urinary tract infection. So you don't want bacteria that know how to move. The exception to that is a really nasty bug. It's called Actinomycetum accumbens. And it's a bizarre bug. It sits still. It's not fun to look at all. And it attacks 8 and 9 and the lower first molars. Why does it like those? I don't know. But Debbie was showing you a bug that just likes enamel. Another one likes cement. Another one that likes gingival fluid. So they all have their own little areas that they like. And AA, if you ever find somebody that has real deep pockets around their 2 front teeth, check their first molars. They got AA in there. The microscope won't show it because it looks like all the rest of the junk in there. But that's a very bizarre bug, and it's real nasty. And it usually attacks black women. And that means it also attacks black men. And so, if you remember from the slide yesterday, the 2 people in the picture were both African American. So, why does it like to attack African Americans? I don't know. But I don't know why it likes centrals instead of cuspids. I don't know. Ask it. But that's the exception to the rule. Basically, every other guy we're after is a bad bacteria that is a mover. And so the biggest problem is that when you're new to the job, you think it's just touch it here, touch it here, touch it here. No. Flush it here. Flush it here. Slow down. Flush it here. And then just the flow of the stuff will get rid of most of the organisms. And if you've got something in that water that's not good for them, that'll get the ones that are left behind. Iodide is hooked up and iodine is not. These are orbals. Lots of different things will kill bacteria. We were talking yesterday about oil pulling, which about 3 people in the world will do. because it takes about 20 minutes, and you know they should go jogging in that time. And oil of oregano, tea tree oil, the creosote bush. The Native Americans in the Tucson area use the creosote bush, and you'd say, well, why would they do that? You know, and if you go to Tucson and you get out of the airport, there's a creosote bush, and there's a creosote bush over there, all over the place. They used what was handy. And why is it called a creosote bush? Because it smells like creosote. Kills bugs. So they'd sit there and scrub at their teeth with a stick that kills bugs. The neem bush is the one they use in Africa, because it grows all over the place.
There is one really bad actor that will take a special program on your behalf from your hygienist or dentist, and it's called one-celled animals, amoebas and trichomonads, that are frequently found in severe cases of gum disease. These are parasites. This animal lives in the gums, but it also lives in the jawbone, or the liver, or the intestine. It's throughout the body. So if you just kill it in the gums, it comes back. You never really got rid of it. You've got to kill it everywhere, and there is a way, but you can't swallow a pill to kill an amoeba in the gums. You've got to put the antibiotic in the gums and the body at the same time, and that takes a knowledgeable professional.
I want a nice fresh drop of saliva, and I'll try not to poke you with my,
Thank you very
my
much.
tip, and see if I can. Now these guys always like to live up in the back, and so I'm going to go back up in the back, nice around, nice mercury filling up here, and see if I can see if any of your friends are up there. If we don't have some of your little friends in there, then they're hiding out too much today. So this is the fuzzy stuff that we see. It's just plaque. It's the gook that can cause tooth decay. It's not the pathology. The stuff we're looking for is moving. They're jumping. They're swimming. I call them the usual suspects.
Right, there's a rod form.
Down on the bottom of the screen, there is a bug having babies, because it looks like link sausages.
Yep.
You know, where they get the little contraction in the middle, and pretty
Yep.
soon then you got two of them.
Well, I've got spirochetes here.
Spirochetes are really bad actors and look like snakes. They eat blood, and they can bite through mucosa, and they're smart too. They can even bite a white blood cell, like right here. They wriggle in unison to make a pump, like a heartbeat. And they'll take a rod and bite on its side, and then move together to create a circulation around the gum of saliva, so that more germs can fit into a smaller area and eat you. Bad bugs look vastly different than good bugs, and a healthy mouth is your very best insurance for a healthy system, especially your heart. The hygienist's job, should you decide to accept this mission, is to find and destroy bad bugs. By doing this first, before any dental treatment, you will prevent bad bugs from getting into the bloodstream and causing a whole host of systemic problems. You'll love your work, and your patients will love you.